We all have what's akin to an alarm system in our brain. It alerts us to danger so that we can respond to it appropriately. However, what if this is a false alarm? Similar to an actual alarm system that goes off, it's jolting, it's emotionally uncomfortable, can be even physically painful. OCD is very similar in how it functions in the brain. It's sending constant error messages to the person who has it. And it's incredibly painful, incredibly difficult to actually ignore the false alarm that's occurring. Think of OCD in three parts. First of all, there's the recurrent, unwanted, intrusive thoughts, images, impulses that are oftentimes uncomfortable if a person takes them seriously. The second part are the responses to these. If a person takes them seriously and sees them as a threat when they're actually an error message, and that's part of the treatment, is to determine what is real, what is not, with this brain-based disorder of OCD. If a person gives in to them, if they respond to neutralizing strategies, avoidance, compulsions, rituals, it only makes it worse. The third part is the disruption caused in the person's life. Work, relationships, school, finance, every area can be touched and influenced by OCD. And so as a person begins to work on treatments, they begin to get their life back. But it's hard work. But there is hope. Even in recent history, just a few decades back, OCD was thought to be untreatable, but there have been some incredible breakthroughs in the treatment of it. Psychopharmacology has been found to reduce symptoms on average 20 to 40%. But CBT, cognitive behavioral therapy, which I practice, has been found to reduce symptoms by 60 to 70% on average. And a specific type of CBT that is most effective is ERP, exposure and response prevention. This treatment, though, has to be extraordinarily structured. It is hard work, hard work. Effectively, what is done is that a person has to learn how to sit with discomfort, sit with pain, with fear, and to learn to not ritualize or compulse or neutralize on that, which if they do, that only, if they ritualize or compulse, it only reinforces in the brain that maybe they need to fear this. They're learning that maybe they can't handle this. But slowly over time, as a person begins to learn and apply the skills of ERP, they get their life back. And it's an amazing thing to behold. I stand with those who stand up against OCD. I'm Justin Hughes, licensed professional counselor.